Good evening.
As an anesthesia practitioner, ethics is defined as a branch of philosophy that examines rights and wrongs, what should or ought to be done. Clinical ethics refers to the application of science and understanding of morality in the field of medicine and health sciences. Ethics is concerned with what is good for medical ethics are for non-malfeasance to the patients. Second one is autonomy. The patient is an independent being of who can make fully informed decision regarding his or her own health care, and coercion is unethical. Third one is justice. Fair when providing their service to the surgical patient. Fourth one is beneficence. Do good. Anesthesia. Patient is mostly unaware of anesthesiologist's presence or begin the screen. It invariably involves using machines and gadgets in patient care. Ethical issues can be categorized into pre-operative, intraoperative, and post-operative for better clarity. Pre-operative issues are there is a lack of familiarity with the patient, which can be prevented by effective communication to establish a good rapport and knowing how much to explain to anesthetic process in order to get an informed consent may help in avoiding fear in patient to refuse the procedure. Many a time, fitness for surgery is given by general physician whose opinion may be in conflict with allergists. Interaction with patients, surgeons, other colleagues without having a direct conflict. Interoperative issues are anesthesiologists should guard the patient's modesty and be compassionate to their feelings when they are in the operating room. Calm and quiet nature of the anesthesiologist may be misinterpreted as docile, so it is essential to remain assertive and avoid domination by other professionals during patient care. During post-operative, the anesthesiologist is the period responsibilities until the patient is discharged. Relying on the surgeon for post-operative pain relief, which can have ethical implications. Teaching ethics in anesthesia. Traditional approach of learning ethical principles through incorporating issues pertaining to ethics into every clinical very effective in awareness among the students. ISA recommended ethics are before taking up for surgery, we should do pre-anesthetic checkup of the patient, which includes history, relevant investigation, which should be assessed. Second one is optimization of the patient. If the patient is not fit, adequate referrals and investigations should be done. Informed consent for anesthesia procedure. Last one is checklist before inducing the patient and documenting it in IS. Intraoperatively, the anesthetic should be present to it should be it should start every 5 minutes. Complications or adverse events, if any, should be documented. Post-operatively, we should ensure safe transfer of patient from operation room to post-anesthesia care unit. Communicate with the patient and its attendants at the end of the surgery. This is a legal term that implies autonomous, informed patient require medical surgical treatment. Patient happens to degree their capable. They need all the relevant information to enable them to make independent decisions based on the relevant facts. Component informed consent are there are 5 components. First one is disclosure, complicated, lack of coercion, competence, informed refusal. Disclosure. Informed result consent process require honest disclosure of medical information to the patient, vital to provide as much information as possible to the patient to facilitate decision-making process. Legal and ethical standard require that the physician accurately discuss therapy, including no therapy. Disclose common risks because they are more likely to happen. Disclose the serious risks because the consequences are severe. Second one is comprehension. Inform the consent must be comprehensive to the patient. It should be explained in the patient's own language. If needed, an interpreter may also be used. The patient has any communication problem like deaf, dumb, and blind. Special attention must be taken to make sure that he has understood everything properly. Third one is competence. Autonomy to make medical decisions in the absence of the capacity or competence. Competence is a legal determination. Capacity describes necessary skills to participate in medical decisions. Four elements of competent decision making: reasoning, evidence of choice. Legal age for valid consent in India is 18 years. A child more than 12 years can give a valid consent for physical or medical examination. Coercion. Informed consent for treatment should be given by patient's free will, undue pressure or influence from doctor, nurse, or any relatives. If a patient voluntarily asks to consent to procedure that may have significant benefits on the patient's medical practitioner as the application of continuing to information on the procedure or treatment. Actual written consent. If of the patient must be obtained in the presence of two independent witnesses to provide admissibility of the consent. Patient and witness should write a signature, and relationship between them should be specified. For illiterate patients, formal impression and mentioned below the impression. Substitute consent or proxy consent. When consent is taken or obtained on behalf of a patient who is not competent to give consent for medical treatment or refusal for the same. It is acceptable in the case of minor, unconscious, patient under anesthesia or sedation, mentally unsound, any emergency case where near relative blanket consent. It is a common practice at the time of admission. A patient is asked to sign a printed format in which consent is taken for any type of procedure or surgery without specifying any treatment. This type of consent is legally invalid and it should be avoided. Withdrawal of consent. Once it is unlawful to profession. Refusal to give consent is as important as giving consent, so it must be recorded with date and time. Informed refusal. The patients have the legal and moral right to refuse treatment, even in life-threatening emergency situations. Informed refusal must be obtained and documented over the patient's witnessed signature. It is advisable that two doctors document the reason for non-performance saving surgery or treatment as express refusal by the patient. Discharge from hospital against medical advice, this should be recorded and signature should be obtained. Examples of informed refusal include such as request to withdraw life supporting care in ICU, do not obtain resuscitation in the operating room, refusal of blood transfusion, refusal of pre-operating testing such as HIV or pregnancy testing. If the refusal to the treatment may harm other parties, court may overrule that the patient undertakes the treatment. Consent in relation to publication. A registered medical permitted to publish photo or patients without their consent in any medical or another journal by which their identity could be revealed. Is not clear. Consent in relation to medical research in India. Consent taken from the patient for drug trial or be as per Indian Council of Medical Research guidelines, otherwise it shall be considered as misconduct. Thank you, sir.
So this is a little boring and dry topic. So instead of discussing on what Priyan presented, I'll straight away go for the presentation, which is mainly made out from the Miller.